I would expect it to be more difficult to treat a tuberculosis infection when the bacterium is in latent form because it is considered asymptomatic, meaning that those who are infected don't know they have this infection unless because they don't show any or have any symptoms of having tuberculosis unless they got a skin test or blood test. People can live with the infection for years or a lifetime without knowing that they have it. However, once the person knows that they have the infection, it is recommended that they seek treatment immediately so that it doesn't spread to others, because once the bacteria becomes active in the body, it starts to multiply, and that's when it becomes the tuberculosis disease, and that's when it can be transmissible to others. Um, the antibiotic regimen is about 6 to 9 months long, and it is recommended to, and it is they have to stick to the 6 to 9 month regimen, otherwise they may get sick again. Um, Also, I feel that it is more difficult to treat a drug-resistant tuberculosis. You can be prescribed for first-line drugs like isoniazid and rifampin, um, but you can be resistant to them, and this is called MDR-TB, which is multi-drug resistant tuberculosis. In another case, you can be resistant to first-line and second-line drugs, which is XDR-TB, which is extensively drug-resistant tuberculosis, which is a rare type. And on that note, if a patient is infected with the extremely drug-resistant form of tuberculosis and refuses to follow their doctor's orders, I feel that it is okay to to admit that patient into a safe, comfortable facility, not quite a jail, but a facility where they feel safe until the treatment is effective. The patient should be informed about what should happen if he were to leave without treatment, and bad how important it is and why they should be held in a facility, so that they completely understand why so they can completely understand that it is a serious disease, a disease that is easily transmitted to others. It is important for doctors to explain that this type of disease is easily transmissible to others because it can be fatal to themselves and others if they don't seek treatment, especially to those who are in, who have like really weak immune systems. They can get really sick if it were to be transmitted to them. I feel that it is also important to control the transmission of this extremely drug resistant form of tuberculosis as much as possible. So I feel that admitting a patient who is resistant to seek treatment should be held in a facility so that others are safe this from this form of this disease.